I'm not going to work in the way that I used to consistently. I'm not being as responsible in this other area of my life, whatever that might be. So just maybe I might have a problem. And so that's another stage along the motivational interviewing. And so along these, and using this particular tool, this therapeutic intervention, we're trying to help them get a sense of where they might be at. And the next step is trying to get them to take some action. Okay, so if you're saying this, if you're saying you got a problem, what are you, this is what's available. Are you willing to go to outpatient treatment? Are you going to continue counseling? Are you continuing to go to 28? Are you considering possibly going to 28-day inpatient treatment where you will be inside for 28 days, being educated, counseled, talked
supported
about with tools of treatment that will help you better understand and keep in focus that this disease, this problem will continue to be there, but you can address it and really put it in remission and get on with your life as long as you do the things you need to do, not to become an active alcohol user or chemical dependency, substance abuse user once you leave here. Now, that's after the pre-contemplation. That's contemplation and possibly action.
Got it.
And to address that.
We'll put it like this. Right after break, we're going to talk more about that because it's starting to get a little heavy right now.
True story.
Sounds very interesting.
Ladies and gentlemen, you're listening to Health in Harlem on WHCR 90.3 FM New York, the voice of Harlem. You can call us at 212-650-6903. That's 212-650-6903. If you have any questions, comments, or concerns, you can also hit us up on Facebook. Just log on to Facebook, type in the search box, Health in Harlem.
Boom.
Sean and I pop right up.
Yep.
You can leave your comments, questions, or concerns right there, or just drop in to say, what's up?
Yes.
What's up?
Yes.
Oh, no, like the scary movie. What's up? All right,
And make
anyway.
sure real quick, third caller, give us a call, and you will get a prize of unspeakable value. So
Unspeakable value.
hit us off.
We'll be right back after this break. Stay with us.
WHCR 90.3 FM, New York.
Help in the fight against violence at the 3rd annual New York City Rising Stars Take Charge Basketball Over Violence, held on Saturday, April 6, 2013. The first game begins at 2 p.m. with New York City coaches versus the NYPD All-Stars. The second game will begin at 4 p.m. with New York City's top varsity boys versus celebrities. Basketball Against Violence is a free event and will take place at the City College of New York, located at 160 Convent Avenue in Harlem. For more information, call School Safety Agent Blackwell or Agent Carter at 718-730-8550. That's 718-730-8550.
By the time of his death, Martin Luther King had undergone, quote, a radical revolution of values. Who is the radical MLK? Join us at the Riverside Church to find out on April 4th, 2013 at 7 p.m. Speakers include Ben Chaney, Ramsey Clark, Immortal Technique, Cynthia McKinney, Jamal Joseph, and Dan Wright. That's April 4th, Riverside Church, 7 p.m.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 to 12 midnight on WHCR 90.3 FM. Peace.
WHCR 90.3 FM, New York.
Time is running out, and we must begin healing from without and healing from within. Take one another by the hand, make each other try to understand that.
We have got to learn to live together. All right, ladies and gentlemen, welcome back to Health in Harlem. I'm Maurice Selby.
And this is Sean Shivers.
And tonight our guest is Mr. Michael Jones, coordinating manager of the Chemical Dependency Treatment and Recovery Program at Harlem Hospital. And right before the break, we were just talking about the stages that a person goes through when they're on their way to hopefully quitting these substance abuse problems. And we went through the stages and we said that we have pre-contemplation where they're not quite ready. They don't even acknowledge that there's a problem.
In a level of denial,
Mhm.
you know, I'm not sure. You know, people asking me, talking about my drinking once in a while.
But I'm good. I'm okay.
I'm okay. You
I'm
know
okay.
what I mean? Basically, that's basically with that. Then
That's
it's,
not like us.
And then we have contemplation.
Then it's contemplation where somebody might have said something where a bell might have went off or a connection is made, and the person is able to say, I'm not as okay as I thought I was. You know, my friends, my wife, my husband, my sister, my brother. When I was at that event the other night, you know, after that, I remembered behaving a particular kind of way. So maybe I'm not as all right as I think I am. So just maybe I might want to, because now I might
Now they're
wanna,
thinking about it, yeah.
I'm thinking about it. Not ready
They're
to
not
take
there
any
yet.
action or anything like that, but possibly. So now it's the counselor's job
to get them
to get
over
them,
that hump.
to continue to not just assess them, but talk to them and try to help them identify some behaviors and actions that are not healthy behaviors and actions that might really put them in harm's way in terms of their continued drinking and using.
What's the next one?
And then the next one is if they have that kind of awareness about the problem, to make a plan. Now, for this individual, what is he willing to do? You know, because the person might say, well, you know, and you know, denial is thick in the disease of addiction to alcoholism. So a person might say, yeah, but I can handle this, and I know what I need to do. What I need to do is I need to wake up earlier and eat my breakfast right away, just get myself to work, and I don't think I got to do that much. But if they got a level of insight that they're ready to make a plan, say, well, what do you think about this? What about going to outpatient?
What are my options?
Yeah. What about going to outpatient?
Or what will work
3,
best for me?
Right, 5 times a week. You know, what about trying to become more aware of your problem as it relates to you and get a sense of what you can do about it and build some motivation for you to take some action.
Build a support team
right.
and family and friends.
Will you go into rehab? Will you go into 28-day rehab and do more work on yourself and have more assessments done and have more education done in terms of what this disease is and what you being predisposed to in terms of your continued usage and what you're able to do about it and what you will do about it. A person is really at a place where he's been through the thralls of addiction and drinking and using. He or she might want to go to long-term treatment. Now, they have something called long-term treatment. There's residential treatment that you there for like 6 months to a year, and you involved in various vocational, educational groups, counseling, therapeutic sessions that you really want to get some insight and awareness about what your problem is, which can be done on some level in 28-day treatment too. Don't get me wrong. But the 28-day treatment, hopefully the person will follow that with intensive outpatient treatment.
Got it. So now, see, that's the point of action, right? That we wish to get
what we're talking about,
the
right?
individual.
Action.
Yes.
Right.
Now, the question is, how do we determine what is best for an individual in terms of which course of action is the best? Because we have many modalities, and as you said, we have instances we can have people go away to an inpatient facility to be treated. We can have outpatient treatment and support groups. We have medications that can be available to help with these dependencies. So how do we find the best mode of treatment or modes of treatment for an individual?
One of the strategies, of course, of action that I like to look at is just how severe this person's drinking and using is and how long and how stable they are in the community. And
okay. I'm sorry to interrupt you. We have a caller on the line with us. Caller, are you there?
I'm here.
Hello. I'm very well, and yourself?
Good. This is Valerie calling with a question for Mr. Jones.
How are you tonight?
I'm good. I'm good. Mr. Jones,
Yes.
you mentioned that sometimes some of the patients are in denial when they come in. So I'm curious to know, what are the requirements to get into the detox program?
Well, if they're motivated enough to come in, all they have to do is come to an assessment, appointment, and various assessments will be done, and they'll be admitted. If there's a bed available, and it's usually people go home from detox every day, pretty much. So there's usually at Harlem Hospital, but there's detoxes. I'm not so much promoting Harlem Hospital as I am promoting treatment. So now there's detoxes all around the city, but Harlem Hospital, we have patients, clients, leaving every day. So if you call the admissions, you can get a bed, and we don't require.
Can you come in for treatment just solely on marijuana?
No, not at the chemical dependency medically supervised detox unit. This is for people that have opioid dependencies and alcohol dependencies. These are people that will get sick if they don't have alcohol or heroin. So they need certain chemical additives to help them make the transition from physical dependence to their body getting back to a place of equilibrium where they no longer need substances. But there's also resources available for people that have marijuana addiction, and that's where outpatient and rehabs come in, because the medically supervised detox is for people that are physically dependent on a chemical, on a substance, which is usually alcohol or opiates, which is one of them is heroin. But the marijuana addicted individuals and cocaine addicted individuals, which are not physically addicted substances but more psychological, they also need education and counseling and help brought to a place where they better understand what's going on in terms of their continued usage, and given the opportunity and the motivation to take a look at what's going on and what's happening.
Well, I
with the
appreciate you
usage.
giving me the distinction between the psychological and the physical addiction. Two differences. That was important.
Okay.
That was definitely important. Thank you.
Thank you.
Thank you for calling in.
All right.
Bye-bye.
Okay. So
getting back to the motivational interview, and we talked about pre-contemplation, we talked about contemplation, we talked about making a plan for treatment, and then we talked about utilizing that plan, taking action.
Yes, sir.
And the hope is that the person connects with the resources so they remain in remission. I say in remission because I like to help a person appreciate that this is one day at a time. You want to say that, you don't want to say that, or the rest of your life you're going to have to be going to treatment or going to 12-step recovery meetings. But you want to help them appreciate that they might have to address this one day at a time the rest of their life in terms of doing something. Because, see, the disease, going back to the disease of addiction, is, we call it insidious. That means it'll come at you from various different places. Like, one of the most common triggers is a person just gets some money in their hand, and the first thing comes to their mind, I want to drink, I want to use. They may go around the old neighborhood that some of the things that connect with them in a kind of stimulating kind of way is, I remember that area. I remember that building. I remember the girl.
And they connect that.
There. They connect that with the using.
With
that girl, with that time, with that memory.
And so they want to regain it. It's so like nostalgic.
Right. So it's really, where can you go that you might not see a liquor store? You may not see a person to remind you of such and such. You might not get some money in your hand to remind you of. Because in the beginning, all of those things are going to be very prominent in the beginning. It's later on when you've done some work on yourself and you've got into treatment and you've used the tools of treatment and you start going on a 12-step recovery where you're making meetings and you're getting support of other alcoholics and addicts saying, this is what I do to stay sober. And that has been proven to be one of the most valuable, have the most therapeutic and spiritual value to help a person after they've done a certain level of work to stay sober, that researchers has come up with, after treatment, continuing to go to 12-step meetings, being around your peers that's trying to get sober, that's staying sober, and using the tools that they're using. I wanted to talk about one more,
Actually,
at least one more.
Actually,
we
let's hold off on that one. Let's go to break.
Yeah, we're going to take our last break,
No
ladies
problem.
and gentlemen. You're listening to Health in Harlem on WHCR 90.3 FM New York. Remember, you can call us at 212-650-6903. That's 212-650-6903. The third caller will receive a prize, ladies and gentlemen. We'll be right back after this break. Stay with us.
WHCR 90.3 FM, New York.
Man Up in Harlem is a by men for men ministry that focuses on creating positive changes in the Harlem community through prayer and community service. The group hosts a men's empowerment hour every Wednesday at 7 p.m. in the Polo Grounds House and Community Room, and a weekly prayer walk every Thursday morning in several locations. At the prayer walk, members pray together in a football-style huddle about community issues. Man Up in Harlem's slogan is "Don't talk about it, be about it." If you'd like to join a prayer walk, meet at 6 a.m. at the 155th subway station for the Polo Grounds House Walk, or at the Dunkin' Donuts at 126 in Amsterdam for the Grand House Walk. For more information, please check out www.manupharlem.org.
Hi, I'm Vinny B of the Vinny B Showcase. Tune in every Thursday from 8 to 12 midnight for some solid cultural roots music and some sweet lovers rock. Also, informative interviews and giveaways. Right here on the Vinny B Showcase every Thursday, 8 through 12 midnight on WHCR 90.3 FM. Peace.
WHCR 90.3 FM, New York.
That's all right, because I want you to say.
Welcome back to Health in Harlem on WHCR 90.3 FM New York. I'm Maurice Selby.
And this is Sean Shivers.
And tonight we have Mr. Michael Jones. He is the coordinating manager of the Chemical Dependency Treatment and Recovery Programs at Harlem Hospital. And this man, thank you very much for coming, man. He's very passionate about his work.
Yeah, it's very deep. Very deep.
And
Thank you.
And you wanted to share two more things with us in terms of when we talking about the action portion of
therapeutic interventions.
Yes.
Okay.
So
for chemical dependency to help a person get to the place of addiction, physical addiction, actively using to a place of remission and recovery.
Got it.
We already talked about motivational interviewing, which was the process from pre-contemplation to taking some action in terms of trying to do some work on oneself and having that kind of insight and awareness to be able to say, I have a problem.
Yes.
And I need to do something about it. I'm ready to do some work. So between them and the counselor, who the counselor is the expert, is supposed to be the expert, and between the two of them, and his disclosing what's going on with him, and the counselor comes up with the tools and resources to address those issues. I also wanted to talk about cognitive behavioral therapy. That's another therapeutic tool and intervention where the counselor, the patient does what you might call homework. The counselor gives him homework to actually go out there, do some things to stay sober, like go to meetings, go to treatment, but come back and tell me, write down, come back and tell me what happened, what you thought, what you felt when you went to this place, the old neighborhood, around the old neighborhood, you got this money in your hand, you went to the family, and they said, they said,
it happens.
They said certain things to you, and this might have been the first family gathering that you've been to since you've been in treatment, in recovery. And I want you to come back to me. Tell me what you felt. And so the counselor, being the therapist, having therapeutic tools, engages the patient and helps him better understand what he felt, how normal that is, and that the possibility of healing can and will take place if he stays committed to the treatment. So that's and so there's tools and writing that goes along with it.
And that is cognitive behavioral therapy.
Right. And Sean asked me to talk a little bit about methadone.
Yes.
Methadone is
the methadone
agonist,
treatment. Yeah.
Right, the methadone treatment, analgesic. Actually, it's
because I'll be honest with you.
It's a synthetic opiate that helps you not have to use illicit opiates.
Now, question, because it's not because I get the impression, or people that I've talked to get the impression that once you take heroin or whatever the case may be, you're addicted for life, and you need to take the methadone like a patch for like the rest of your life, or you have to get hits of methadone for the rest of your life. Is that true, or is that just a myth, or?
Well, you know, people get on the methadone program to help them have a pharmacologically prescribed medicine that would keep them from going into withdrawals when they're an opiate user, and be able to function in society without buying heroin and all the things that go along with buying heroin, all the subculture living and behaviors,
the risks,
putting us at risk of the criminal justice system related risks.
But is it true that you have to be on it for the rest of your life if you were an addict?
You have to be on it as long as you want to be on it.
Exactly.
If you get to the place where you feel you've been on it and you've been able to function in a particular kind of responsible, sober way, that you've got some things back in place of family, relations, job, and you no longer want to continue with that. You get the program will detox you down from, say you're on 40 milligrams. That's the average usual milligram that a person's on, like 40 milligrams. But actually, I've heard today people on 100, 110.
Depending on their tolerance.
Right, exactly. But now, say this person has been functioning to them pretty good in society and in relation to functioning and doing things in their life that are progressive and productive. So they said they tell themselves that, I don't think I'll continue to need this. I want my program to bring me down. And they'll bring them down from, say, 80 to 85. To 75, to 70, to 65. And bring them down all the way down to 10 and 5, where they'll be able to get off if that's what they want.
Well, I'll put it like this. My thought process to heroin, I guess, and I'm looking at this to the community as a scare tactic, because from my impression of heroin, if you take it and you get addicted to it, it's almost to a point where you never can, it's going to be very difficult to get off of it, or to, I mean, the way you're describing it is that it's going to be, I took heroin, I'm addicted to it, now I want to get my life back in
but now you're talking about methadone. That's what you're talking about. Methadone.
Is that
Yeah.
So basically, you need the methadone in order to help you
not go into withdrawal.
Correct. But I'm saying if you do take the heroin, and you get addicted to it, it's going to be a long process. I mean, you can't just say you just can't wake up one day and say, I don't want to take it no more.
No, you're going to get dope sick.
That's what I'm talking about.
In terms of the methadone you're talking about. For sure.
And in terms of the heroin.
The heroin.
If you take the methadone, you won't get dope sick. You won't go into withdrawal.
That's the point of taking it.
But the methadone is
it's something that you have to take.
A legal synthetic opiate that will help you not go into withdrawal.
Exactly.
And that will be prescribed to you and given to you free.
Correct.
From day to day. So now you can function just like the
Any
average
other
normal
individual
person without all the other aspects of buying heroin.
But what I'm saying is that you now have to take methadone, another drug, in order to prevent you not wanting, to get over.
So the thing is, that is one of the criticisms.
Medication. You're taking a medication now.
Yeah, now you got to take it for the rest of your life. Correct.
No, as long as you want to take it. Not the rest of your life.
And the thing is, that's the thing. You can look at this as a bridge, right? Medication, because we talked about some of the risk factors for using some of these chemicals in the first place. And once we deal with some of those socioeconomic factors, the psychological problems, what methadone allows us to do is we use this medication to basically stabilize the individual, right? So that we can reduce the use of the illicit substance, whether it's heroin or another illicit substance. But also, at the same time, this prevents the withdrawal symptoms,
That's
which
right.
we want to avoid, and it gives
prevents
us time
the
to deal
negative
with
aspects of the heroin use.
exactly,
Right.
and then we can deal with some of those other issues,
Right.
such as it could be HIV infection, it could
Right,
be the psychological problems, it could be other chronic medical problems that the individual has, and in the meantime, they're taking the methadone. And when they get to a period where they're stable, then we can start to talk about a methadone reduction.
Well, the
program.
question that I have, and I just want to understand a little bit more, is that if you are addicted to this drug, I'm not talking about methadone, I'm talking about heroin, and then let's just say that you just decide one day that you don't want to be addicted no more.
To
is
the
it
medication, to the methadone medication.
No,
to heroin.
to the heroin.
heroin.
Is it an easy process? Because I'm getting the impression that it's not an easy process. Even if you say to yourself, I don't want to do it anymore, you still going to have to go through some type of treatment.
Okay.
You're still going to have to take methadone. So the point I'm trying to say is that when you get hooked on heroin, it's very difficult, even if you want to not be addicted anymore.
Okay,
For sure.
That's the point that I was
Right,
trying
so
to.
let me address
Yeah,
Sean's point.
yeah. If you can.
Yeah, in a very concise way, because that's where I work on the chemical dependent medically supervised detox unit. Patients come in there addicted to heroin, using anywhere from 4, 5, 6, 7, 8, 10 bags a day, right? What we generally give them on the first day, say, is 30 milligrams of methadone. They might get 10, 10, and 10. Okay? Now, they're on that unit for about 5, 6, 7 days, usually 5 days. That's broken down to maybe the next day they might get the same thing. Then the day after that, they might be given 15 milligrams. Then the day after that, they may be given 10. Then the day after that, they may be getting 5. Then the day after that, they'd get nothing. And then nothing. And they're discharged. But now, if they say, or if they start experiencing really severe withdrawal symptoms, then we have to re-engage them around giving them some more methadone to let them stay a little longer, maybe giving some other medications that help ease withdrawal symptoms and help them like that. So now you're talking about two different things. Now that person might be as motivated, might be motivated enough to say, I'm gonna utilize this detox in that kind of a way and go on from here to rehab and get some education, counseling, and help to stay sober. But another person might say, I need to get on the methadone program. You know, that's a little too fast for me. The craving, the urge is going to come back, and I'm not going to.
And that's the only point that I was trying to say is that when you find yourself addicted to heroin, it's going to be a tedious process too, and I don't think cure is the right word, but it's a tedious process.
I like to say remission.
Yes,
remission.
It's a tedious process that may happen for a very long period of your lifetime. But, you know,
So we want to thank you very much, Mr. Jones, for coming through
deep
tonight.
conversation today.
Yeah, man.
I've learned, though. I've learned. There's a passion, and I think a lot of listeners in the community can sit in your seat and say, you know what? When he was speaking, I can see myself probably saying that or doing that. You know what I'm saying? So
I'm sorry I didn't have more time to talk a little bit about 12-step recovery, but don't forget Alcoholics Anonymous and Narcotics Anonymous in those programs. If you struggle with trying to stay clean and you've been going to outpatient or you find yourself relapsing without using a program, keep those in mind. And you can go online or you can call information and find out where one of their meetings are or where their offices are to get a list of the meetings around the city.
Well, actually, can you let the community know that if they needed assistance in your area or if they wanted to join chemical dependency, what number can they call at Harlem Hospital?
Well, there's two numbers. They can call 212-939-3154.
3154.
That's me.
Yes.
That's Michael Jones, coordinating manager, Chemical Dependency Detox Unit, and I would be able to give you some information about where these 12-step meetings are and might be. But if you want to come to Harlem Hospital Detox Unit, you want to call 212-939-3033 and 212-939-3030 and ask for a Miss Gonzalez or whoever.